Hello, everyone. What we're going to do in this video is we're going to talk about the portfolio project. And the portfolio project is something that you will finish at the end of your time at Concordia University. And it's a review of the 9 program outcomes and the student learning outcomes. And it basically, you demonstrate to us how you've mastered those program outcomes or you've developed competency in them. So we're gonna start this here. And anyways, it provides an evidence of self-reflection of the knowledge and skills that you've developed throughout your clinical experiences, the didactic courses you had, the different assignments that you had, all actually are mapped to those 9 program outcomes. And so you demonstrate to us by showing examples of your work for the different program outcomes. So it's really competency, it's patient panel characteristics, meaning that when you get into your NP clinical hours, which you're going to be starting in fall, you'll be able to take those and you'll be able to use those, some of your SOAP notes or your history and physicals as artifacts for this project. Also, you will get, once you do enter your patient care hours, you'll be able to see charts. And the charts will document like how many patients with hypertension you saw, how many patients with type 2 diabetes. They'll show you the levels of the complexity of the patients because you have to code them. It will also show you demographics such as age, sex, ethnicity, and whatnot. It'll also show if you're in the FNP track, how many well child checks you did. And so it also will show, all those different characteristics, numbers. What was the total number of patients that you saw while you were in this program? So it helps you also, if you're going for a job and you wanted to submit your portfolio, there's an opportunity that you can take the information from the portfolio and put it into a nice type of a handout or you can actually do a link so that they can get into your portfolio. So a prospective employer could see what kind of a patient load you had while you were in school. So like, let's say you were going for an endocrine position and, you wanted to highlight the complex diabetic patients you had, the type 1, type 2, the number of insulin resistant patients you've seen with obesity, or the numbers of patients that had diabetes and other comorbidities, such as hypertension or cardiac disease. Also, the portfolio is a professional development. It basically kind of takes you from the beginning of your journey, where you're newer into some of the concepts or the levels of knowledge that you needed to achieve as a nurse practitioner. And it kind of walks you through where you started from and where you are now. So the portfolio is actually housed in Project Concert. And so in the old days, we didn't have Project Concert. So people wrote a paper. It was usually between 20 to 25 pages in length by the time they finished it. So when we started using Project Concert for your residency hours, as well as your NP clinical hours, they had a portion there for the portfolio. So we converted to that. Let me tell you, it's a lot easier doing it this way than it was with having to do a paper, like a manuscript, because that was APA and it was all those other kinds of things that you needed to include in a paper. So in Project Concert, you don't type it on a Word doc and then cut it and paste it into Project Concert. You type directly into the template in Project Concert. And the reason you should type directly into the template is because sometimes if you do a Word document and then transfer in, the formatting isn't right. And you can't read it from my end. So, somebody put in, I'll give you some examples of things not to do. Put in like a JPEG, or don't put in like any scans from pictures let's say you went on a global trip, or you did a community project or something like that, and you had pictures. Project Concert does not lend itself to uploading pictures. A lot of times when students would do that, the picture was so big in that program, it would be like I would see part of a face. I might see an eyeball and part of noses or whatever. And there was no way I could crop the picture to bring it way back down. So you don't want to upload any JPEGs, pictures, or scans. Yeah, please do not take a picture or scan something and then try to upload it, because it doesn't work in Project Concert. You don't really have to use APA in this when you type right into Project Concert. However, if you decide you're going to do some quotes from you're going to have to do like, what is your philosophy? Or in the introduction, sometimes people have used a quote in there. If they did something like that, then they have to do a reference in that text box. So, but this is not required for APA. Probably 99 out of 100 do not have any citations in there that they need to use a reference or whatever from APA. But if you did something like that and you needed to do APA, please use the APA 7th edition. The other thing is, when you type into Project Concert, please leave a space between paragraphs and make a paragraph. Sometimes students have put in, it's been like a paragraph like this long, and it just keeps going on and on and on and on. And there's like no natural break there. So please try to do, breaks if you're doing paragraphs. And you will be doing paragraphs for this. So make sure you put a break between it. So let's talk about the first part of the Project Concert. Now, you're not doing this semester, but I have all the guidelines. The guidelines are going to be loaded up into Blackboard as soon as I'm finished with this taping. So you'll be able to see what the guidelines are, and I'll show you those when I finish the PowerPoint. You're only going to do one small part of this project. You're only going to really address program outcome 1, 3, and 5. So the first part that you're not doing this semester, but you can start working on this if you like, you have to do an introductory statement of reflection. It's really a summary on your personal and professional growth and development while in the program. So oftentimes I'll see, like, sometimes people will say, when I started this program, I thought I had an idea what a family nurse practitioner did. But now that I've been in clinical, my view has changed, or I didn't really realize X, Y, and Z. Or the other thing is, like, sometimes people will discuss like the transition from thinking like a nurse to thinking like a provider, an NP, right? Because you have to apply what you learn in the didactic setting. So in your courses like your pathophysiology or genetics, your health assessment, and your APN courses, and then you have to go into clinical and apply that into a patient scenario. So, that's difficult. That takes some time to stop thinking like an RN at the bedside and now thinking like the provider. Now you have to try and go through the different steps. Like if you think of iHuman steps, if you can follow that, I always say the secret sauce from iHuman. If you follow that, you will hopefully eventually get to the answer that you need to get to when you're working with patients. So that introductory statement, reflection, summary, usually around 2 to 4 paragraphs. And sometimes people consider a paragraph like 2 sentences. I don't consider it that way. A paragraph is more than 1 to 2 sentences. So make sure you have enough meat and potatoes in your content so it doesn't get returned to you. This doesn't happen very often, but I did return one a couple semesters ago where the person had like almost for the whole thing, like 2 sentences for her paragraph. You could see the person just quickly threw it together and hoped it would stick. Well, I read everything and I open up all the artifacts. So just so you know. The next part is the philosophy or personal mission statement. Now, you guys worked on this in Nurse 534. You read Jesus Christ CEO. So when you read that, you looked at what is a mission statement? What is the vision? Kind of what's my philosophy? It might be like holistic. Somebody might be holistically inclined to work in a underserved area, those kinds of things. So you kind of identify what is your philosophy when you're working with patients, so anyways, you'll be able to review some of your work from 534 on that. And usually it's 1 to 2 paragraphs. It's not anything in depth or big. And then the next section is you're going to project ahead and you're going to look at, well, where do I want to be at 1 year when I'm out of school for 1 year? So a lot of times people will say, well, I want to make sure I've passed the boards, and they'll identify what board they're going to take. I want to become more comfortable in a primary care setting. I want to be less dependent upon my mentor. I want to be able to increase my patient volume or things like that. That would be like 1 year. 3 years, oftentimes people are starting to think about, and these are, again, just examples. You tone it to whatever your personal wishes are for what you foresee what your practice is going to be. So at 3 years, sometimes people say, I'd love to be a preceptor. I would love to take students and kind of pay it back for the preceptors that have taken you. We hope at some point you'll help it pay it forward now for other students, right? So people want to be preceptors. Sometimes people want to go more into a specialty. They might have been working in primary care and maybe they want to work cardiac, or maybe they want to add another certification. We have students who are coming back now. We are starting a psych mental health track. And you have to be a licensed NP. It's a certificate after graduation. So now we have students coming back to get their psych mental health. And sometimes people will say that, especially in like years 3 or 5. And then 5, hopefully by at 5 years, you're an expert in your field. And sometimes people, want to go back to school, or they maybe want to change clinics or write an article. They want to do some research or things like that. They might aspire to have a leadership position. So those are all kinds of suggestions that you can think about. But again, you don't need to do this part yet. And then how will faith be infused in your practice? It's usually 1 to 2 paragraphs. Now, I decided to put it in our discussion post for this week. I decided to put that question in there. So as you're thinking about, when you're becoming a nurse practitioner and you're out in practice, how will you infuse some of the attributes or the core values that you have into practice? So, this is something that you can start practicing now. We've got that question for you, and you might want to just type it into the project concert portfolio area. These are all sectioned out in those areas. So maybe you don't want to do it now. Maybe you want to do it when you have to do it at the end. But as I said, I'm trying to get you moving. We didn't really have this in this course. It was more residency hours and implementation. But this is the first time we've taught these courses for you guys. So, I've seen where some people are done, some people are solid, some people started a little bit late. So everybody's kind of a little different point. So I thought, what, let me try and see if I can help you do some things that are going to be required of you at the end. And I'm going to help you get those done now. And I'm going to tell you, you will be smiling at the end of this program, because the next semester that I have you, I'm going to do 3 more. So of these program outcomes, because you'll have had your epidemiology course, and you'll have had your informatics course. So I'm gonna do 3 more of those program outcomes next semester when you're in the 4th one of these. So you'll be in 933. And then the second part, this is the bigger part of this whole project, is using the project concert template, and you're going to address each program outcome. So each program outcome, there's 9, and I'm just going to say, so the first program outcome is synthesize liberal arts and scientific background into advanced nursing roles. Well, the reason I chose program outcome number 1 for you to do, because you've had a lot of arts and science courses now, so you're able to address this program outcome. So they're really, again, the student learning outcomes, the SLOs, you don't need to address those, but they give you an idea of some of the things you might write about when you're discussing how you develop competency in the program outcome. So I just read you one. Let me read you the student learning outcomes. 1A is integrate nursing science with knowledge from ethics, biophysical, psychosocial, analytical, and organizational sciences as the basis for the highest level of nursing practice. So you've had tons of courses. You had your genetics, your patho, your pharm, your health assessment, your organizational leadership course, your evidence-based course, your policy course. So any of those courses would fit this program outcome 1, synthesize liberal arts and scientific background in advanced nursing roles. So that was student learning outcome 1A. And the last one in here is student learning outcome 1B, integrate science-based theories and concepts to design advanced strategies for improving health and ameliorating healthcare delivery disparities and for evaluating outcomes. Okay, so again, some of the courses that I mentioned before, like 534, you did that QI project in there. That certainly was strategies for improving health and ameliorating, well, not necessarily healthcare delivery disparities. It might have been. But anyway, so that's kind of an example. So I mentioned all of these are the program outcomes are listed in the addendum in every Blackboard course. And for this project, there's 9 program outcomes, and you need to provide 2 examples, or we would call them exemplars or artifacts, all the same thing. 2 examples of your work that shows that you develop competency for that program outcome. So you need to have a total of basically 18 different assignments from your various courses throughout the program here. And I'm going to tell you, you've had a lot more than 18 courses, because in the master's program, sometimes people say to me, well, I can't think of any. And I'm like, well, look at all those courses you had. I'm sure you had different assignments for them. Let's kind of go through them. Let's pick those out. And even when you look at your syllabus for each course, there's that big box in there with the table with your assignments. Well, that also tells you what program outcomes hopefully are met in that course. So that's another way to look at what program outcomes and student learning outcomes were covered when you look at the syllabus. But again, you don't need to specifically address the student learning outcomes. They're there just for you to give ideas and break it down so that you know what we're looking for. But it's the program outcome that you need to address. And then for each exemplar, artifact, or example, you're going to write 1 to 2 paragraphs for each of those assignments, showing us how you met the competency. So I just mentioned, like, an example for the one was the QI project in Nurse 534. That integrated nursing science with knowledge from psychosocial, analytical, and organizational sciences, right? That would fit in there. And also you integrated science-based theories and concepts to develop advanced strategies for improving health. That was the QI project. You had to go to the evidence to look at what were evidence-based articles so that you could look back on to see what were the outcomes. So when you developed your program. So it's just 1 to 2 paragraphs, not 1 to 2 sentences. And sometimes people do more, that's okay. I mean, we can't read 5, 6, 7. I mean, I can't read like full pages. None of this is like full pages. It's usually less than half a page, like a quarter of a page or half a page. And that's kind of a, I guess that's kind of somebody who's very, 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 very thorough. We're really only looking for 1 to 2 paragraphs. So 1 paragraph, make sure it's a solid paragraph for each artifact. So the thing on here is that you have 9 program outcomes, so you need 18 examples. You can use 1 artifact, 1 example of your work 2 times in the whole paper. So let's say, I'm going to make this up. let's say I'm working on program outcome 1 and I put my PCOT question in there. And then I look at program outcome 3, which is about scholarship and an analysis and implementing and evaluating evidence-based approaches to advance nursing roles at the systems level. That's evidence, right, from your 915 class, I think it was. So anyways, so what you're going to do is you're going to say, okay, I can use that PCOT final paper or whatever for program outcome number 1, but I can use that one again in program outcome 3. Okay, so you get one like that. Otherwise, you have to have 2 different outcomes for each of the other program outcomes that are left. I hope you get that, because I know sometimes the master students confuse this. I've had some students that have used the same program outcome or the same paper like 3, 4, 5 times in the portfolio. I have to send it back to them and have them do it over again. It's only one program, one paper that you can use 2 times in different program outcomes. So I might have used, I'll just say the informatics group project PowerPoint. I might have used that in 1 and in 4. Then I'm done. I can't use any more duplicates. I have to have original exemplars or artifacts. So you may only use one artifact in 2 different program outcomes one time in this project. You need 16 different artifacts if you use one artifact 2 times, right? Because 18 minus 2 is 16. Okay, so then the second part on here, when you save your artifacts, this is a tip for you. When you save them, what you're going to want to do is you want to label them. So like if you're going to use a SOAP note, put SOAP and then put COPD or hypertension or DM2 or whatever, diabetes mellitus, type 2 or whatever. So you can do that, or like it's a leadership paper, or it's a PCOT paper, or it's your PowerPoint from a presentation in informatics. So make sure you save it like that. Don't just save it like SOAP 1, SOAP 2, SOAP 3, or just SOAP. It doesn't give us, the reader, any idea. And I'm going to tell you, sometimes you guys make mistakes where you'll upload the same SOAP twice because somebody just wrote SOAP when they saved it. And then when they went to upload it, they uploaded the same SOAP 2 times, or they uploaded the wrong artifact. So it's really a lot easier for you if you can label it. The other thing is too, is that, you can have, I'm going to go through this more, but you can have like a substantive leadership discussion. So like, I'll give you an example, like when we did 910, the business course. Okay. In there, remember I had you go to ARC and you could pick out a topic that you were very interested in and provide information on what you found. Was it a statistical brief, or you told us about what the project was about? Like I can't remember, one was on something with I think OB, and I don't remember if it was depression. There was one on ER. I think there was something on obesity. So some of those, that would be great to put that kind of discussion into this portfolio. You guys did a great job on that, and I learned a lot. Actually, that was kind of a fun assignment for me. And so you could put down leadership OB discussion or leadership ER discussion or whatever. H&Ps, you can use PCOT paper, QI projects. If you use a voiceover PowerPoint, none of us would have time to go through and listen to a voiceover. What you want to do, and sometimes in Project Concert, you can't upload it if the file's too big. If that's the case, if a file is too big to upload because it's a voiceover, what you should do then is put it into a PDF. So if it's a PowerPoint, put it into a PDF, and that works really well. Then you can usually upload them. And then when you're towards the end and you're doing more of this, like your SOAP notes is really what I'm pretty much talking about in discussions. Those 2 areas I kind of find sometimes a person will put in a discussion that they didn't really say too much in the discussion, and you're kind of like, I'm not sure how that shows that you're competent with this concept. But anyways, show your best work. So not just simple assignments. Look at the most complicated assignments you had. Some of the things you work hardest on that you're so proud of. Show us what you're proud of. It's like if it was down to 2 people for a job and they wanted to see your portfolio, wouldn't you want your portfolio to shine on how hard you worked and what you accomplished versus something that took you, 10 minutes to write up a SOAP note or whatever on conjunctivitis or a simple ear infection. We would be looking for things that are more complicated. And then I also have, and I'm going to put this in the course, I'll show you this. You're going to complete the portfolio program outcomes and artifact list, and you're going to submit it in Blackboard Dropbox, along with the statement you're ready for me to review your work. So when you finish this assignment for program outcome 1, 3, and 5, again, the most you would probably have to do is like 6 paragraphs, because it would be 2 paragraphs for each, or because you have 2 artifacts, or if somebody did, a couple paragraphs for each program outcome, it would be a little bit longer, but this isn't a huge project. I'm breaking it down for you. But I have a portfolio program outcomes and artifact list. And all you do for that is you put down, I'll give you an example, like a SOAP, AFib, and then you put what course it was from. So was it nurse? I'm sorry, I can't remember your new numbers now for this program because I haven't gotten up that far yet. But I'll just say something else. Let's say your QI project from 534. You would just write it on the sheet of paper. And the reason I have you do this, because when you take your policy class, there's some other courses that sometimes there's similar assignments. And this way we know exactly what class it comes from. So, and then it also helps you not duplicate assignments. You can kind of see where you're going to put the assignments. And there's many different places. One assignment might go in 3 or 4 different, it would be a match for 3 or 4 different program outcomes. You just have to pick out which one you want it to go in. So you might even want to use scraps of paper or cards, index cards, to kind of lay out where you want it to go. It's things that, you want to make sure that's fit. So like an example where things that don't fit is like somebody would put in for program outcome 4, that's evaluate information systems and patient care information technologies. So your assignments that you're going to do in this class starting next week, your informatics class, 2 assignments in there could go in program outcome 4 and you'd be done with that. We'll do program outcome 4 in 933. So you might want to save up some of your work already. So that's about informatics. So something that wouldn't really go in there would be something from, let's say policy, you wrote a paper on let's say, social determinants of health and patients that are on Medicare. That really wouldn't have to do with anything for healthcare outcome, patient care information technology. So it wouldn't have anything to do with the EMR. So it wouldn't fit in that one, right? Or like that, the one from the EMR course, it wouldn't fit really into the professionalism or the highest level. Like that would be more of your SOAP notes, your critical thinking. Somebody came in with a lump in their neck, so you're going to make sure it's not strep throat, obviously, if they have a sore throat, but it could be something like Hodgkin's lymphoma, or it could be oral cancer or things like that. You know what I mean? So it's something that when you get up to the 8 and 9, those are the highest professional kinds of things. Things from your roles course. What does it mean to be a nurse practitioner? What are some of our code of ethics? What are our standards? What's unique about our profession? So like the paper from there, that final paper in the role course, that goes in 8 and 9. that's a great place for that. So think about where you want to put the things. Okay, so here's those types of artifacts. Try to submit a balanced portfolio. And the reason I say that is when you get to your next courses with NP clinicals, you're going to do SOAPs and you're going to do histories and physicals, right? So sometimes people have put in over half of their portfolio. They just pulled out SOAP notes or H&Ps that they did. Well, it wasn't really balanced. So try to get, try to have like a wide variety of things that you're submitting. So some of the examples were, any graduate course that you took at Concordia, it can't be from undergraduate. It can't be from if you transferred in a credit from someplace else. It has to be courses from CUW. Look for complicated SOAP notes, H&Ps. Avoid really simple urgent care. Somebody came in and they had dermatitis, or they got a mosquito bite or something like that, and it was a little infected, and you had to tell them to use some triple antibiotic or, bacitracin or whatever. That's not what we're looking for. Look for something that's more complicated because, this is the time to get experience with the most complicated cases you have, because it's going to help you when you're out as a nurse practitioner. That first year is the hardest, honestly. It is a hard year because every patient that comes in is new to you, unless you took a job where you had your clinicals at, or you're in an outpatient clinic like Johnny and you took a position there, then you're going to know people. But for most of you, you're not going to know patients, and it's exhausting because every patient is new to you, usually, especially in your first months. So try to get complicated patients for you. So the other thing is you can also use like your scholar review of the literature final paper in your research course. That one works well. You've had some iHumans. They give you a nice deck sheet. You can use the iHumans. Those are great competency cases. They're virtual patients, and it demonstrates your critical thinking and diagnostic reasoning. So those are great artifacts to use. You can also use like that final QI paper from Nurse 834 is a good one. The other thing is you haven't gotten this, I don't think, or maybe you have, I don't know. The Barkley standardized test, they have deck sheets. So like the Barkley for knowledge about patho, pharm, and advanced health assessment. That's good information that you can use for your artifact. You can also use, when you get in your last class, you're going to have these diagnostic readiness tests, and it's from Barkley, and it's kind of give you an idea if you're, where you're at for boards, and it gives you detailed information on the areas that you need to go and refresh on. So you haven't had that yet, but it's Barkley. And then you had stats, you did journal article reviews. I don't know if they still do this in pharm, the kinetic pairing assignment. Also, you have group work, or I don't know if she still does group work in Bio 850, but some of those kinds of things. You can do the bio courses too. Anything that you had as part of the curriculum that for your progression plans that you're required to take. I don't know that you take an MBA 895. I don't think you are, but that's a healthcare, hot topics in healthcare. Or sometimes people would take Nurse 677. That's testing and measures from the nurse educator program. So any substantial discussions I mentioned before, that one from 910, or some of the other discussions from that course you could use, and other courses you can use as well. You'll be doing at some point, if you haven't done it yet, a resume and a cover letter, and then a clinical plan. You did that in the Rose course. So those are some examples. That's not inclusive, but just some examples. Okay, so if you have questions on this, let me know. I'm happy to meet with you because I know it's hard to digest. So I'm just going to change to this other document if I can. It's the guidelines. If I can't get it up here, it's going to be in the course. So hang on just a second here. Okay. So here is this is the post BSN DNP portfolio guidelines. And so you're going to be able to take a peek at this. And this is what I just gave you in PowerPoint format. So it's basically why we're doing the portfolios, type directly into the template in Project Concert. We don't have to use APA unless you cite something. The other thing is make sure you don't just do a Word document and then pull it all over, because the format is not right. At least on our end, we're the reviewers, and I'm telling you, somebody put in another picture. Honestly, it was like a toilet. It was like a roll of toilet paper. I could only read maybe sometimes two words on a line. And it just kept going on and on and on. I mean, there was no way I could read that. So the person had to take it out and redo it. So I'm trying to give you tips so you don't have to redo anything. You get it done on the first time and you're fine. So remember I told you you had the introductory statement, your philosophy, your goals for practice. I don't need paragraph on this. You just put first year, third year, fifth year in different lines, and then just write the information. Some people write a sentence or two, that's fine. Some people split it up and maybe write a little bit more paragraph. Like some people will say, you know, I want to get oriented to my job and I want to feel comfortable by year 3. Now I feel comfortable, I might be able to do a medical mission, or I want to work in underserved areas now, or whatever, you know, whatever you think your practice will be. And then how your faith will be infused. So B through D, so those I just read through, it's in the same template. These are all in the same template. They're all listed out. So, and it's all set up in Project Concert. And then, sorry, somebody just scared me. My mailman just put my mail through the slot. So sorry, I jumped. Anyways, so your outcomes. Now, this is the biggest part of this project. You have 2 examples for each program outcome, and you take your example and then you write how it meets the outcome. So let's say, let me see here. I got to click one now. So like professionalism and excellence in advanced nursing. Okay. Or using advanced clinical judgment, number 9. I'll use that one. Number 9, using advanced clinical judgment. Okay. So maybe you have a person that, like I said, came in and they had a lump in their neck. And then as you're going through everything, you know, like, hey, this guy's 50 some years old. The chances he has strep, he doesn't have little kids in his house and grandkids weren't over. And you're thinking, you know, he's a smoker, right? So, I'm thinking that, you know, there could be something more seriously wrong with him. So I'm going to get a CBC. I'm going to, you know, so you kind of start going through what you're going to do here. My plan was if I get the results back and whatever, and I don't find something or whatever, I'm going to have this ultrasounded, or, you know, I'm referring them out, or whatever the situation is. So you tell us about what it was in that encounter that helped you show competency, that you used advanced clinical judgment. So another person had, this was actually a real one. Somebody had, somebody works in oncology, and the person that came in was having these abdominal pains and just didn't feel good. And the testing that they did, really the labs, and I don't know if they did an x-ray maybe, but anyways, it didn't, you know, there wasn't constipation. It wasn't, I think it was a male, it wasn't a female. And anyways, it turns out that in the history, the person had a family history of pancreatic cancer, and it was pancreatic cancer. The student that worked in oncology said to the preceptor, well, this is what we would do from an oncology standpoint. So she told the, preceptor, this is the scans we would get or whatnot. And sure enough, this patient had pancreatic cancer. So that certainly was using advanced clinical judgment, systems thinking, and accountability to provide evidence-based care in the area of specialization or in systems leadership. So use, something that's a real difficult case that you had. And everybody should have difficult cases. You should always be asking your preceptor to see some of the hardest, because that's where you're going to learn the most, right? If you took all the easy ones, what's going to happen when you graduate and you get out, and now you've got somebody who's got diabetes, COPD, heart failure, and has allergies to meds and is on blood thinners and whatnot. You're going to have it's going to be more challenging. So try to get those experiences while you can. So anyways, you're going to write the couple paragraphs for each artifact here. And then one of the things too is when you submit these, there's a few things that we don't accept. So we don't accept the H&P from health assessment. Why? Because you basically copy it off the template we made for you, which is out of the book. Okay. So that doesn't really show any critical thinking. You need to do a patient you build for. That's an easier way to look at it. When you're looking at SOAP notes and H&Ps, if you build for it, you can use it theoretically. If you didn't build for it, you shouldn't use it. So the other example will be when you get to your clinicals, you're going to have to do it's called a telephone SOAP scenario. So your preceptor she has a certain situation that she'll be the patient and you're going to be the provider. And so she has a script that she or he will go through with you. And then either he or she, when you ask the questions, it prompts the preceptor to provide answers for you. So it just checks to see if you can walk through a case, basically. But that's not something you build for. So you wouldn't put that into this project concert. I talked about the duplication. It's there again. I talked about the portfolio program outcomes and artifact list. And then there's a portfolio grading rubric. I'm working on that. That should be up this week, maybe even Monday. Our administrative assistant will be typing it right now. The rubric we have right now has the program outcomes for the MSN program outcomes in it. So I have to have those all taken out and they have to type in the DNP program outcomes. And so I wasn't able to get that done this past week, but they'll do it for me probably Monday and it'll be posted. But it's only pass fail. That's it. It says pass fail. So there's nothing magical about that. It's just program outcome 1. And then we have the program outcome 1 written. And then there's a rubric in Project Concert. And when we grade it, we just type it right in there. And then we can make comments if we want. And then when we submit it, you're able to see it. But I won't be able to submit it because I can't sign off on it. I'll give you feedback, but I won't be able to completely fill out the rubric for you. I'll do something different. I'll do my own written rubric and give you feedback in that. And then whoever reads your portfolio at the end signs off on everything. So I'm just getting you ready for 3 of these. So, so that's it. That is it. So if you have questions or you want to meet on this, I'm happy to do it. Just let me know. Okay. All right. Here's to a great semester. I'm here to help you. I'm here to get you over that finish line. Okay. I'm probably the person who's yelling the loudest when you walk across that stage because I'm so proud of all you guys. And you got this. You can do it. All right. Have a great 4th of July. Bye-bye.